We started the Canadian Concussion Center in 2011, and our prime goals were to do research and patient care. So right from the start, we mapped out projects that would involve finding out more about concussion. It was really a black box. We did not know much about it when we started. We had a team of Carmela, Tartaglia, and myself, and gradually we've grown. There probably are 35, 40 people in various parts of UHN that are now involved, especially for patient care, which is multidisciplinary. That is one of the big projects that we developed. In other words, a team of people who can handle all the different issues that are faced by patients who get concussed. We also wanted to add to the knowledge of concussion. So not only treat patients properly, but figure out why they're suffering for so long, exactly how the brain is damaged in concussion. And there still are a lot of challenges that we are trying to meet.
Yeah, I think over the years we've, learned a lot about concussion, that, it is a brain injury. We've learned that some people don't recover as quickly as we would like. And I think what has become very apparent in the last decade is that even one concussion can increase your risk of a neurodegenerative disease and dementia years later. And so the importance of concussion has definitely risen, I think, in the eyes of patients, their family members, but I think as a society, we realize that a brain injury is a serious event.
Patients have so many symptoms. It can be overwhelming to patients. For example, if they have headache, a memory decline, agitation, anxiety, PTSD, sleeplessness, the multiple symptoms, which has been part of our research. We've published even 65 symptoms from concussion. We never believed that when we started that it would be so complicated. It is one of the most complicated conditions that exist, and we've made a contribution to the field with our research into the causes of concussion, how they manifest with so many different symptoms.
I think one of the other things that we've recognized now is that there's such a heterogeneity in the symptom constellations that people present with. And so, really no two people present in the exact same way. We know that the risks are different across the sexes and gender, across the age span, so that there's a lot of uncertainty in how to even address people, because the concussion is really one of those problems that really requires precision medicine, where you want to know as much as you can about the person, because their medical history, their contextual history, their psychosocial history, as well as their circumstances, can all impact the recovery. And so, that's why we need a multidisciplinary team to address that. But also, we need to bring precision to this problem, because we still don't know why two people can have the same hit, and yet one person walks away not even feeling any symptoms, and another person ends up with, lots of disabling symptoms that persist for months and even years in some cases. So lots of things to learn still.
When we first started, we focused on sports concussion. That was the major issue. So many young people, for example, were being injured in football, rugby, hockey, even volleyball. But it became apparent soon after that other causes were also important, that many people were being injured in motor vehicle crashes and getting concussion. Intimate partner violence turned out to be a very significant cause of concussion. Injuries at work, for example, school teachers have a greater risk of getting concussed, and other work-related injuries in construction, for example. So the variety of causes of concussion wasn't really apparent to us at the beginning, and so now we're able to offer this service to people no matter what the cause of concussion.
Yeah, I think we've been actually quite active in trying to understand, so what happens when somebody has a brain injury? Because that's what a concussion is. And so, even trying to identify a marker that will tell us somebody has had a concussion. Because, when you think of that a concussion can set you up for being at increased risk of a neurodegenerative disease, everybody talks about, these repetitive head impacts and chronic traumatic encephalopathy. That's the CTE that ends up in the news and people are quite aware of. But the issue is that you need to think, how does one concussion, how does that one event set you up? Because actually that's what the data shows. One concussion can set you up to be at higher risk of dementia. So understanding how that brain injury evolves into a neurodegenerative disease is actually, a core feature of our research program, and we actually don't know what that is. And so, we actively evaluate people who've just had a concussion. We get blood, we look at their eye movements, we do a lot of clinical assessments to see, okay, what has changed to give somebody those symptoms that they have? And then, do any of these changes actually predict how somebody's going to do? Because that's the thing. There are hundreds of thousands of concussions a year in Canada, and most people get better over time. And so how do you predict who is not going to get better? Who needs more help initially? And more importantly, in terms of the risk for neurodegenerative diseases, okay, so how can you detect what's going on so that you can actually prevent the neurodegenerative aspect of the disease? And so our research program is really dedicated to this, to trying to understand what is the mechanism of a concussion and how does it set you up for these delayed consequences of it?
Well, the importance of prevention of concussion is by the Rowan Stringer story. And Rowan Stringer was 17. She was the captain of her high school rugby team, and she got concussed in a rugby game on a Friday, didn't tell any adults about it. The following Monday, she had another concussion, and then on the 2 days later, on the Wednesday, she had her final fatal blow, which was also in a rugby game. She was upended, her head hit the ground, and she never woke up. She was taken to the hospital very quickly, operated on, tried to decompress the brain so that the swelling would have room, but all to no avail, and she died. So here's an example of concussion being so important that it can cause the death of a 17-year-old kid. That doesn't happen very often, fortunately, but lots of people carry the damage of concussion for the rest of their lives. There are people who virtually never recover. So over the last few years, we've come to realize the importance of concussion. And Carmela mentioned how many Canadians are concussed in a year, for example. 400,000 Canadians are concussed every year. And not all of them get better. So most of them come to your office, some of them come to my office, And it's a lot of patients who are requiring care for concussion. So yes, the importance of concussion is very, very high on the scale.
Yeah. And oftentimes because of the multitude of symptoms and the heterogeneity of symptoms, what ends up happening is that, their doctors in many cases become, overwhelmed themselves by, you don't know what symptom to address first. You don't know what symptom is setting them up for delayed recovery. Some people can't go to work, can't go to school. Some of the older people, their lives can be completely upended. They have a fall. They don't break a hip, luckily, but afterwards they can't get back to their homes because, they've had some cognitive changes that occur. And so this could have serious repercussions. And so to call it, a mild brain injury, well, it's mild in the sense of there's no big, brain loss. But, it's not benign. Concussions are not benign. They are a significant injury because it is a brain injury, and all injury to the brain is, not really benign.
So Rowan's Law came in Ontario, I'm very pleased to say, in about the year 2017 or 18. And this was a first for Canada. We were hoping that other provinces would follow because, for example, in the United States, when concussion laws were introduced in the state of Washington after the injury to a youngster whose name was Zachary Lystedt, who was about 13 when he was playing football, got a huge brain injury and never fully recovered, although he didn't die. But unfortunately, Rowan Stringer, who had such a major injury in rugby, didn't make it. So that just sort of emphasizes the importance of prevention. How can we prevent these youngsters from getting concussed? And I think Ontario should be congratulated for bringing in a law. Now, nobody's in jail because of the law, but because it is a law, people pay attention to it. So parents pay attention to it, and teachers pay attention to it, and coaches and trainers. So everybody is now aware in Canada of the importance of preventing concussions. And we really are pleased with that this development has happened. We worked hard to make it happen, but it has happened. Public is much more aware of the importance of concussion and how to prevent concussion. And we coined the term concussion proofing, like waterproofing, concussion proofing. I think it's a pretty good term. And it's important to prevent even one more concussion, because think of Rowan Stringer. If we had prevented one of her concussions, she might be alive today. So it's that important. An older person who gets concussed may never recover their full mental capacity afterwards. You see so many people with diminished mental function, can't remember what they had for breakfast because of multiple concussions. So let's concussion-proof everybody.
Yeah.
Even preventing one more concussion. And we have people who come to us after 10 concussions.
Yeah. Yeah, and that's the thing, that there's many different ways, of getting concussed. And so we have to, target different aspects because, there's concussion proofing for children who are playing in the playgrounds and you want them to play, but maybe there's some, safety measures that we can try to, promote so that, less children get concussed. People at workplaces, we often think of these high-risk jobs, but there's all kinds of jobs. People hit their heads on their desks. Is there something about the way things are placed where we could concussion proof. The teachers in the schoolyards, often will get hit at recess, or, there's different ways for people to get actually hurt in schoolyards. And, older people, there's, falls are a big problem. And so, how do you concussion proof people? Maybe by preventing more falls, by having, safety checks in their homes, motor vehicle crashes, so many of them for, distraction, all kinds of reasons that, maybe we need to change some laws. Maybe we have to, concussion proof people from motor vehicle accidents by changing the rules, changing what's, the way the car is made, something. Because these accidents that were once thought to be quite, minor, can be life-altering for people.
Also, think of what we have learned about repetitive concussion. So we now know that if the second concussion usually occurs at less force than the first concussion. And the amount of force necessary to cause your 10th concussion may be just a simple hit on the head. So people become more susceptible to a blow. And the recovery is longer after a subsequent concussion. So it may have taken you 3 months to get over the first, but it may take 3 years to get over the second concussion.
Yeah, exactly.
So all of this makes prevention even more important.
Yeah, exactly. And then the repetitive head injuries put you at increased risk of dementia. The more of them you have, the higher the risk. Repetitive head impacts have been implicated in chronic traumatic encephalopathy. Actually, it's the only risk factor that we know of. But as well, lots of evidence to show it increases your risk of Alzheimer's, Parkinson's disease, even ALS, or Lou Gehrig's disease. So,
and it's just recently that brain injury got on the list of risk factors for all of those degenerative diseases.
Yes.
That people, as they get older, are subject to those diseases because of what happened earlier in their youth. They just had too many concussions. So concussion proofing of youngsters is really important.
Exactly. I think a big one is, this idea that you have to lose consciousness to get a concussion. Still, we hear that quite often, saying, oh, I didn't have a concussion because I didn't lose consciousness, or they told me that I didn't have a concussion. It's like, no, that isn't correct at all. You can have a concussion even if you don't lose consciousness, if you don't have amnesia. You can have a concussion actually even if you don't hit your head. If you get a hard hit to the body, you can get concussed. So that's a very significant misconception, because that means the person doesn't even get diagnosed at all. So, I think another one that we've now got a lot of evidence for is how to improve your chance of recovery. Not that long ago, people were told to rest, and unfortunately, people were resting for months even, and now we know that actually it's the exact opposite. After maybe a day of taking it easy, you don't really have to completely rest, but maybe take it easy, you are encouraged to actually become very active. And we know that low impact aerobic exercise is what you need, and you slowly ramp up, but that the exercise is actually good for the brain and good for recovery. Another misconception that we hear often is that we think that males and females have the same risk of concussion, and mostly that's been because a lot of the focus has been towards males. But actually, females are more susceptible to concussion, and their prognosis tends to be worse because it takes them a longer time to recovery. I think that's, something that's really important, because that means that we're going to, again, need personalized therapy so that we're not treating everybody the same.
You'll recall we just published our paper on motor vehicle crashes and concussion, and found that women are much more susceptible to concussion when they're occupants of motor vehicles in comparison with men. And especially rear-end collisions are causing so many concussions among women. And we think that it has to do with neck muscles, that anthropometrically means what you were born with as a woman are smaller neck muscles than the average male. And that may be a reason why the head sort of does a bobblehead effect after a rear end collision. For example, your head goes back first and hits the head restraint, and then you go forward, and that jiggle of the brain as you go back and forth is what causes concussion. The physicists can identify that this is acceleration of the brain, either rotational acceleration or linear acceleration, but it is jiggle of the brain that causes concussion. And because the neck muscles are not as strong in women, they're more susceptible, and that is held for motor vehicle crashes, some sports like hockey and also basketball has been shown to be causing more concussions in women proportionately than in men.
Right. Yeah, no, I think that's the whole point, is that we have to think of people not all being the same, and concussion isn't all the same. And so, I think, we've spent a lot of time trying to figure out what is the marker of concussion in you. Is it in a blood test, in eye movements, and, a brain scan? Right now we can't make diagnoses. And so that's another misconception, is people think there's some test, but actually, our research program is dedicated to this, but today there are no tests that can detect a concussion. There are tests to detect something more severe than a concussion, but right now a concussion is a clinical diagnosis. And so the imaging is there to make sure you didn't get anything worse, and it cannot detect that you've not had a concussion. And so when people say, well, the CT head didn't show anything, well, that's good, but it has nothing to do with a concussion, and people still don't realize that.
It is amazing how long it has taken to develop a biomarker for concussion, and we still don't have it. Yeah. The whole world of scientists is looking for that magic biomarker. I was hoping we would have found it by this time, but even after 15 years, we still don't have a good biomarker. It still requires a good clinician like Carmela Tartaglia to say that is a concussion.
Yeah, but we are getting closer. We do have some good candidates. We do have some markers that tell us that there's been something that has happened to the brain, right? We have a marker that tells us that there's been some neuroaxonal injury, which means that this is of the brain. We do have some markers that say, maybe there's been some inflammation there. And so we are moving in that direction, but of course, it'll take a while before these tests become ready for prime time. Like anything else, takes a while. But I think the first step was to recognize that it was a brain injury. And that means the field, then, including us, started to look for a marker of that brain injury, just like in other diseases. But until that was recognized, people weren't even really actively looking. And so I think we will get there.
I'm optimistic as well that gains are being made. Like if you think of our brain donation program, where we've actually had people who want their brains examined after they're done with them, after they've passed on from whatever reason. They want to know what the brain was doing to cause all those symptoms from concussion. And fortunately, we have been very successful in developing our brain donation program, where people send us their brains from across the country. I think we're still the only group in the country that has a brain donation program. And look at the gains that we have made. Recently, we've even shown that it affects the spinal cord as well, that repetitive hits can cause damage to the spinal cord as well. That was a very exciting discovery that happened right here.
Yeah, Yeah, we also were one of the first to show that there is a multitude of pathologies in addition to CTE, and really focusing on, some people can have 5, 6 different pathologies in the brain versus, the focus had always been only on the CTE, which is of course important, but the fact is that maybe the CTE is making you more prone to developing all these other pathologies that, is now we know that all diseases have more than one pathology usually, but still, in CTE, the focus had always been one pathology, and now we recognize actually we need to be concerned about all the pathologies that can happen after repetitive head impacts.
And I think your work, for example, has been recognized because you've just been invited to be part of an international committee to examine the concept of brain degeneration after trauma.
Yeah. And, I think the field is moving towards, trying to identify people during life, right? Unfortunately, CTE is still, as you know, a post-mortem diagnosis, which means unhelpful for most of our players. We have a large program, and many of the people are doing quite well, right? They are at early stages, if at any stage of disease, and they want to know what can they do to prevent their brains from getting the CTE. They've already had the concussions. They cannot change that. But they want to know, is there a way to detect it? And then is there a way to prevent the accumulation of these pathologies? And, we are part of the group trying to create clinical criteria so that we will be able to identify people at higher risk, working on biomarkers to be able to confirm diagnoses, with one day hopefully being able to intervene before people develop dementia. We can stop the progression of the disease.
Another important program that has evolved over the years is patient education, to educate people about their condition. And I just love the fact that we have been able to continue to keep up our bi-weekly webinar program sponsored by the Laborers International Union of North America. They've funded us for several years now to maintain patient education. And we have great speakers who have come forward to present talks on headaches and dizziness, how to change your diet, exercise, like a whole hour program on exercises that should be done. As you mentioned, exercise is now one of the preventions that we preach.
Yeah. And, it's so nice to see that, there's people from all over the world. I think we counted, and there's like 20 something different countries, like attendees from 20 different countries. It started off, it was just for patients and for their families. And now we have even healthcare providers that are part of that. So I think there's, this recognition that this is important, and that, these people are suffering and they need to be treated. And so I think that's one of the reasons that we have many more healthcare providers joining that webinar series, which, as you say, has expert speakers. Mental health, huge issue in patients, as you know, with patients with concussion. And so we have, a great speaker on talking about mental health and some of the medications, some of the treatments that there are. So I think most patients provide great feedback for that.
This multidisciplinary aspect of care for concussion patients is also something that has evolved in our unit and elsewhere, that we now require psychiatrists, psychologists, neuropsychologists, physiotherapists, occupational therapists, et cetera, et cetera. There must be 20 different disciplines now that have put their minds to helping people with concussion, and we have many of them on our lecture series.
Yeah. And we also have many partnerships with people across the world to be able to promote concussion and the treatments that are going to become available, to think about, how do we even define some of the problems related to concussion. So I think, we've managed to create a number of collaborations with different groups to be able to promote, the prevention of concussion, the treatment of concussion, the acknowledgement that concussion can have prolonged symptoms that can be debilitating or even set you up for some degeneration later on in life. So I think we have created really nice collaborations also with many different partners.
Remarkable change from when I went to medical school. I never heard the word concussion with respect to the brain. We knew about a spinal cord concussion, but a brain concussion was not mentioned one time during my medical training.
Me neither. And I didn't go the
You're
same
not
year
as
you did.
ancient as I am.
It's only recently that it's actually become part of the curriculum. And thanks to somebody who's working in our clinic that really took it on to teach the primary care physician residents about concussion. Because until recently, and we teach it in neurology,
Yeah.
but it isn't as well known as it should be.
Mm-hmm. Well, I think there are a lot of improvements coming. Like, I would like to see better treatment for headache. I'd like to see better treatment for dizziness. I'd like to see better treatment for the psychological effects of concussion. Like, we have people who are so injured psychologically, severe depression, severe anxiety, crash nightmares. Imagine having a motor vehicle crash and then waking up at night a year later and still reliving the crash. Can you imagine how terrible that is for patients? So I'd like to see better treatment, that we can provide even more help.
Yeah, I think I think it would be really important to be able to be better at detecting what has happened, and then you could provide some treatment that. So there are symptomatic treatments, which obviously are very important because a headache can be debilitating to somebody, but I would like us also to be able to target the brain injury itself and be able to develop a treatment that would, really target what change has happened, or be able to at least track that change so that when somebody feels better, to actually know, are they better? Should they be able to go back to doing things, so that we could prevent getting a second concussion while their brain is still healing, hopefully prevent the cascade of neurodegeneration that's set up for decades later. So I'm hoping that we will understand mechanistically what happens when the brain jiggles.
I think that's extremely important to know exactly what the mechanism of injury is, and we would be farther along in being able to devise treatments.
Yeah.
I think the important issue is to come for diagnosis of concussion early on. We should be seeing people like within a day or two of concussion and start the process of early exercise, early improvement in diet, early treatment of headache. The earlier patients can come for treatment, the better off they are. So I'd like to see an acceleration of our process.
I think it's also important that, patients be educated. So one of the things that we see is that people get a diagnosis of concussion, but then, their history is not aligned with what other people are feeling. Like they got better in a few days, and why am I not better and I'm at the month out? And so to really understand that everybody heals at their own rate, but that we are still optimistic that they will get better, but it might be slower and they may need interventions. And so I think it would be very important to people get education, do all the right things, like, make sure they're exercising, make sure they're getting good sleep, make sure that they're, if they have mood symptoms, that be treated. If they have headache, that be treated. That it really be, this is a brain injury has occurred, and the consequences of that brain injury need to be addressed, because the problem is that what people sometimes fail to recognize, that when you have a headache all the time, or when you don't sleep well, that you are not going to be cognitively 100%. You just can't be. And so then your memory won't be as good. Your concentration won't be as good. And then you become stressed and anxious about that. And that makes your sleep worse. And that makes your headache worse. And so I always tell people, it's like, we really need to think about addressing all the symptoms and addressing you holistically, so that we can get those gears going little by little, so that you become, the person you used to be. And sometimes it takes a little more time, but that most people, we are optimistic that they can get back there.
The whole world is looking for the magic biomarker that says this is a concussion, and also how severe the concussion is. We would like to have that as a means of focusing our attention on those who have more damage, for example. At the present time, all we have is symptoms to go on. Now, symptoms are plentiful.
Yeah.
In fact, I think the current list we're up to about 80 symptoms of concussion. So we have lots of evidence that the brain isn't working, but we don't have what we call a reliable biomarker. All we have is symptoms. And I think if we had that biomarker, it would be a plus for managing. We would know if we're able to move the pendulum more easily, if we could measure that X in the blood was high or low, just like you can for diabetes or heart disease. We just don't have that for concussion.
Yeah, it would definitely allow us to, be more targeted in our treatments. I think the fact is that, a lot of the symptoms that people have, they actually do have treatments. And that, most of the time we can help people, that they should not be hopeless. There are a lot of people who get better. A lot of people go back to their lives, and that people should remain hopeful about their future.
We can certainly do a lot more now for people than previously. We have very good treatment for headache, for example. We can recognize when there's mental health issues like anxiety, depression, PTSD. We now know that those are very common after concussion, and we can detect them early enough to institute treatment. So when I think of how many people that we can help that we couldn't help 10 years ago, it's really been a gratifying improvement, but we still have quite a ways to go.
Yes, like all brain problems, which concussion is one of. Okay.
So another important development in Canada is that we now have every September Concussion Awareness Week, where we can remind people of the importance of concussion. And during that week in Ontario, we celebrate Rowan's Law Day. So that's a big plus to bring that information across the country to all the kids in school. For example, my daughter's an elementary school teacher, and she tells me she sees Rowan's Law Day posters in all the schools that she teaches in. So that's a huge plus for public awareness of the importance of concussion.
Yeah, I think that's very important. And I think, it's very important to recognize that concussion awareness, was directed towards certain groups. Definitely people were more aware that concussion happened in sports, but we actually have to promote concussion awareness across all areas. So whether it's workplace, whether it's, the elderly, whether it's people with neurodegenerative diseases, whether it's, people who are driving a car, so that they are aware that concussions don't only happen in sports, and that concussions can have very significant consequences. And so they should concussion proof themselves against.
Actually, that's a very good way to put it, that in all sports there should be concussion proofing. Even sports where you wouldn't think concussions were occurring, like volleyball. I've seen many volleyball players who are concussed from a spiked ball. They have to be aware that this could happen, and with the knowledge that it could happen, you can do more to protect yourself.
Yes, and then expand that to concussion proofing across all areas.
Like older people. When an older person comes to my office, they don't leave without me reminding them that a cane can prevent the next concussion. Don't be a hero and think you can walk, as well as you could when you were a teenager. If you've had a concussion and you're unsteady on your feet, you should be using a cane. Or if it's more severe, you can use a walker.
Yeah. No, exactly. Because you want to prevent that next concussion, or the first one, if you're lucky.